Hi, this is Junaid with another update on Healthcare Policy Corner. Today I'm going to discuss some of the updates that happened since my last video on telemedicine and also some frequently asked questions that people emailed me, texted me, etc. about those. And I thought it would be best to actually just also make a video about these questions so it can benefit everyone. I'm very grateful for VeeMed for sponsoring this video, and more importantly, kudos to them for donating their telehealth equipment in this time of national crisis. As you know, US is now leading in COVID-19 cases, and this has opened up telehealth as one of the major ways to provide continuity of care for our patients. During this period, now clearly there is a relaxation of some of the requirements. The first one is that you can see that CMS actually announced relaxation of MIPS quality reporting programs. The other big one is the HIPAA policy. As you can see that in these situations, they have foregone some of the requirements for HIPAA. However, I don't recommend using non-HIPAA based solutions because there are clearly some very affordable like VeeMed solutions available for HIPAA. On the same token, you can see that other medical societies have been pushing telehealth legislation both at the federal level and the state level. And this is very good to see. This is one example from American Academy of Neurology, which I follow closely as a neurologist, but there are other medical societies that are pushing for legislation to be relaxed and significant expansion of telehealth. Other waivers include in the Medicaid situation is the Section 1135. Now 29 states have been approved. This particular waiver helps different programs for participation, relaxes the requirements, including the pre-approval requirements, and of course, requirements for physicians to be licensed in a different state as compared to their current licensing state. So this is also very good news. This can help telemedicine to manage what we call geographic workload, and physicians from different states can participate in care in situations where there is dire need. One of the other big issues that has gone on is that commercial insurance or private payers have relaxed their policies significantly, and there is continuous evolution of this particular policy. So please check to make sure of what is covered at your location. However, these are some examples. For example, Aetna has waived costs for telemedicine visits. Anthem is actually waiving cost sharing. BCBSA has also expanded their telehealth footprint. Cigna is also decreasing the cost sharing. Humana also waived out-of-pocket expenses, etc., etc. So this is very good news for telemedicine in general and for telehealth professionals in particular. Another big thing is what we have noticed, that there's pay parity that is also coming up. Regence, which is a Blue Shield company, will reimburse telehealth the same as in-person visit. So this is again very interesting to see that there's quite a bit of movement towards telehealth as recognized as clearly one of the ways to deliver care in this, especially the crisis situation. However, I think this will continue to be beyond this crisis. Same thing, New Jersey orders all states' health insurance to reimburse telehealth visits during coronavirus pandemic. So this is from the New Jersey Department of Banking and Insurance, and they have laid out the law that all state insurance should pay for televisits. So clearly, some of these legislations are coming from the state level, others are coming from the federal level, and some of the payers are directly including them either way. So all good news for getting paid and for the services that we provide, and more importantly, providing continuity of care for our patients. Another thing, as you can see from Texas, has significantly relaxed the barriers towards telemedicine. And again, you can read that on the bottom where the reference is. Other questions that I received, very important ones. So let's discuss them one by one. Is Zoom HIPAA compliant? The answer is it depends. If your organization/department has a HIPAA agreement with them, and that is a special sort of Zoom method with HIPAA compliance, then it may potentially be HIPAA compliant. So check with that before you actually consider that as a HIPAA compliant option. Do we have to document start and stop time of the televisit? The short answer is no. You do not have to say that the visit started at 9:50 and ended at 10:10. What you have to just say that I spent 15 minutes, which does not include just the video time, which includes the complete level of service, including the documentation. So if you're documenting length of service, just document time spent, or otherwise you can use, of course, level of service codes as well. Are in-home visits covered? During this national emergency, the short answer is yes. Post this emergency, the answer is no. The home-based televisits are only covered for end-stage renal disease patients as of 2020, before the pandemic. During the national emergency is a separate issue, and then post this, I believe it will be, but these things are going to change as we go. So for now, during the national emergency, at-home visits are covered. Do I need to take screenshots to prove in my note that I have had a televisit? No, you do not need to do that. You just need to say that you used a televisit portal and this is the time you spend or the level of service you provided. What happens if my telemedicine visit fails? This is not unusual, unfortunately, especially in rural areas where the internet connections are not as good. The simple way to think about this is that if you finished your exam before the failure, then code it as face-to-face. But if your AV failure was done before the exam, then use non-face-to-face code, and after the exam, use face-to-face coding. So basically, it all depends if you were able to finish your exam or not. Is care other than COVID-19 care covered? Absolutely yes. As a matter of fact, COVID-19 care, urgent care, etc. are of course one of those things that are going to be covered. But during this national emergency, any care, your COPD patient, your CHF exacerbations, your stroke follow-ups, your epilepsy follow-ups, whatever you need to do during this emergency period, all telehealthcare is covered. When do we use modifiers? Modifier 95 is Medicare for synchronous telemedicine visit. This is face-to-face visits that is provided either inpatient or outpatient. Modifier GT is used mainly for commercial insurance purposes. So check again your local policies according to that and use the correct modifier after talking to your billing specialist. However, this is the general guidelines for you guys. Are the licensing requirements relaxed? During this national emergency, yes. But to be honest with you, I don't really see how this is going to be the implementation plan. And I never thought that licensing is a big issue. I think the biggest limitation here is credentialing. Governor Cuomo in New York has relaxed the credentialing rules as well, especially for critical care physicians. But again, there's such a sort of no process that is built that properly ensures that your credentials are privileged. And will you be open for liability? I don't think so. But at the end of the day, it is better to actually understand, more importantly, credentialing process rather than the licensing. Licensing at this point in time is quite relaxed in the 29 states with Section 1335 waiver, as I discussed. Unfortunately, during this national crisis, I think this is the major silver lining, which is telemedicine, which has truly jumped forward by 10 years on the adoption curve. And I truly believe, as we have believed at AINeuroCare, that telemedicine is the future, and all non-procedure specialized care should technically be via telemedicine to save cost on transportation, management, and of course, the more time you actually spend talking to patient is more important than, doing all those other things that are, to be honest with you, sometimes unnecessary. However, there remains to be some challenges. Licensing, as I talked to you about, is relaxed only during the national period, but eventually we also need a cross-state licensing agreements or even a federal level licensing for telemedicine. Credentialing takes a whole lot of a time, and I think there will be better ways to credentialing, e-references, etc. I think state level policies need to be aligned with the federal level. Private insurance should actually have more transparency in how they're going to pay, including an equivalency of pay as well at different places. I think this is going to be something that federal level should actually also enact that there should be pay parity not only between states, hospital systems, but between independent providers and hospital organizations. And lastly, pay parity in the true sense of the televisit should be equal to in-person visit. And those are the things that hopefully we'll get through this, and legislation is moving fast. If you want more up-to-date content on telemedicine, please join this LinkedIn group, link.aineurocare.com/telemed. In this group, we're trying to discuss is how to improve patient and provider experience, designing and implementing telemedicine solutions, share tips and tricks, share experiences, share quality improvement projects, and create a community that is more passionate about telemedicine. Again, the review for VeeMed OS is coming soon. They were very fantastic. They sent me the information. I reviewed it. I made some adjustments. I told them these are the things that need to be corrected, sort of improved upon, not corrected. Just truly, that these things would be very helpful as far as improvement. They took the constructive feedback. They sent it back to their developers, and by midweek, I will have some good review for you guys. Again, thanks for VeeMed for sponsoring this video and donating telehealth equipment in this time of national emergency. Thank you. Please visit, provide me with feedback, and subscribe to my YouTube channel.